having pain with sex or leaking urine, having bowel dysfunction, that shouldn't be your normal.
I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. Oral birth control works well for many women, not just to prevent pregnancy, but also to regulate menstrual periods, reduce PMS and acne, and prevent endometriosis from getting worse. However, the hormones in the pill may impact some pretty sensitive tissue. Get the full scoop from my conversation with Rachel Gelman, clinical specialist at the Pelvic Health and Rehabilitation Center in San Francisco. Well, hey, Rachel, I'm really excited to talk to you today because I think you're a unique physical therapist. You focus on pelvic floor health with women. And I think just to start off with, why don't you share with our audience what in the pelvic floor and in a woman's body do you really specialize in? Because it really aligns with your interests, which I think are really unique and really special for women's health.
Yeah, so I will give a little caveat though that I do see men. So I'd say 50% of my practice is men. Majority of the patients that I'm seeing are coming in for a variety of issues, anything ranging from pelvic pain, pain with sex, urinary dysfunction. That can be anything from urinary incontinence or frequency, urgency, pain with urination, bowel dysfunction, constipation, and pain of anything from, I always describe it as between the ribcage and the knees. So abdominal pain, vaginal pain, vulvar pain, clitoral pain, basically any anatomy then followed by pain is what I end up treating. And what I'm focusing on is, the internal muscles of the pelvis. So the pelvic floor muscles that help support in women, the bladder, uterus, and the colon. Hence why I might be seeing someone for urinary dysfunction, bowel dysfunction, sexual dysfunction, or all of the above. Because if there's something going on with those internal muscles, it's going to infect all the systems that it supports. So again, the bladder, the uterus, the colon. So that's basically what I'm doing as a pelvic floor physical therapist when I'm treating women. And obviously in men, it's all the same diagnoses, but instead of a vagina, they have a penis. So
now with women come hormones, and I understand that men have hormones too, but with hormones, tell us a little bit more about the connection between hormones and, the physical therapy that you do around the pelvic floor, and what are the impacts? What's the relationship?
Hormones are fascinating and tricky, and they can cause a lot of good things to happen. They keep us alive and they impact our heart, our bones as women, and men, but obviously we're talking about women here. So they can have they keep us healthy. And the big ones that usually I talk about are going to be estrogen, progesterone, and testosterone. So those are kind of the big ones that affect women, and particularly the vagina, as well as the vulva and the vestibule, which is a little piece of tissue right around the opening of the vagina. And all of that tissue is impacted by different hormones. So most people always think of estrogen, as we get older, estrogen decreases, and that has a negative impact on vaginal health. But when we are younger, estrogen is helping keep the vaginal flora happy. It's helping keep that tissue nice and supple. Progesterone also plays a little bit of a role. It also impacts, menstruation, as well as when you're looking at pregnancy. Progesterone plays a really big role during pregnancy in allowing basically fetal development and things like that. And then testosterone, which most people don't really think that much about, but it has a huge impact on that vestibular tissue I mentioned earlier. So that opening in the vagina is very much filled with testosterone receptors. So if there is an imbalance in any of those hormones, any of that tissue might be impacted and might lose some of its health, some of its stability. So that's kind of why hormones are important and why it's important to be looking at them in women throughout the lifespan. Because when women are younger, if there's anything going on and they're having symptoms such as pain with sex, pain with any type of penetration, whether it's a tampon, a finger, or a penis, or a dildo, or any object, it could be a muscular issue, it could be an infection, or it could be a hormonal imbalance. So that's kind of where hormones play a really big role in looking at pelvic health and looking at women's health in general, because these areas of the body are all impacted by hormones.
When we tend to think about the pill, birth control pill obviously has an impact on hormones. It's kind of the most well-known substance that a lot of women consume. And especially as women get into their 40s and 50s, women stay on till they're fully in menopause and have no more risk of pregnancy. How does that impact hormones? Because there's got to be a lot changing in women in those ages.
I feel like there's no good birth control method out there, really. Like, they all come with different risks and different issues. And one of the side effects that can happen with the birth control pill or oral contraceptives, so I say OCPs sometimes, meaning oral contraceptive pills, is that pill, the way it's processed through your body, it causes an increase in something called sex hormone binding globulin. And that's a protein, and it's naturally occurring in our bodies, and it goes around and it picks up any excess any excess testosterone that we have. When you're on the pill, the way it gets processed is it increases the amount of sex hormone binding globulin. So there's an elevation in that protein. And so that protein now, there's more of them, so they're going to pick up even more testosterone. And so that can lead to decreased libido. And then if we look back on that tissue I mentioned earlier that's impacted by testosterone, it can have a negative impact on the vestibular tissue. So that tissue might become frail, it might become hypersensitive, and it can lead to things like pain with sex, pain with penetration. So obviously, the decision to go on and off the pill is a big decision for women, but it is something to be aware of, that it is going to have an impact on the hormones in your body, which is its intent, like you mentioned. It's going to impact the hormones. But this is something I feel like it's newer research, and so it's not really mentioned that much. No one really talks about it. But that is how it can have an impact on the testosterone levels, and then obviously it does decrease estrogen levels, so it does have an impact on the hormone levels in your body, and then it can have an impact on the vaginal and vestibular tissue, which can then lead to problems such as pain with sex. Sometimes it can lead to painful urination because that tissue around the urethra is also impacted by those same hormones.
Well, wow. Okay, you packed a lot into that statement around testosterone, around the vestibular tissue, around the pill or oral contraceptives and their impact. Let's just to back up for 1 second. Like, on that vestibular tissue, where is it? Is it at the front? Is it at the back? Like, if a woman is having pain with sex or with penetration of any kind, and she might, where would she feel that?
Right at the opening. So it's a really small amount of tissue. It's past, you have your labia minora, and then it's easy to miss. So you have to really look at it, look for it, but it's going to be right at the opening.
Okay. And that, and the health of that is governed by the level of testosterone in your body, for the most part.
Mm-hmm. For the most part,
we
correct.
know the body's more complicated than that, and oral contraceptives are messing with that level of testosterone.
They can. I definitely see women who've been on oral contraceptives forever, and they don't have symptoms. But then I might see someone who's been on the pill for, say, 6 months or a year, and she's like, I'm having this pain. Like, it feels like there's a knife going in my vagina, or it's burning. It's awful. And, I'll take a look, and I might see signs that, yeah, you're lacking some testosterone. It's your opening vagina is very red. Sometimes I see that, sometimes I don't. Either way, I will recommend that they go see a specialist. So either a gynecologist or urologist or urogynecologist, someone who's specialized in ideally sexual medicine and hormones, and ideally will do a blood test to look at the hormone levels and see if if their levels are imbalanced. So it's never just like, oh, you're on the pill, you probably have low testosterone, you should go off of it. There's usually going to be steps involved. But yeah, so some women can be on it for a long time and they don't have these issues. So it's hard to determine, but it is a possibility.
If a woman has pain in her vagina or with sex or in the pelvic area, how do you know when it's related to hormone imbalance versus something else? And can you tell right off the bat?
Usually I can't, it depends. So the way I usually describe pelvic floor dysfunction or pelvic pain to anyone, including my patients, is there's usually not just one thing going on. It's usually a bunch of little puzzle pieces, and some of those pieces are going to be bigger than others. So for me as a physical therapist, I'm looking at like musculoskeletal restrictions, and I'm assessing the muscles, seeing how they're moving, if they're restricted, if you can activate them, all of that. So that's kind of what I'm looking for. But I'm also going to do a visual observation and see, is there anything going on with the skin? Maybe there's a dermatological issue going on. Do I see anything that, like some redness that could indicate a hormonal imbalance? Could there be a dietary component? There's always like these many different pieces that I'm going to be looking at. So it just depends, and it depends on the patient. If I have a patient come in who, let's say, has been on the pill for years and, has this pain and she has these other symptoms and she kind of fits this clinical picture, then I might say, let's work on what we found with the muscles, but if we don't get very far, these are things we might want to look at. One of them is like the birth control pill and how it can impact your hormone levels. Sometimes, though, patients come in, they're like, I hate being on the pill. I've always wanted to go off of it. So I'm like, well, if you're open to it, maybe try going off of it and see it might impact your symptoms. So it really depends. And then I might have a woman come in who just had a baby, and obviously childbirth is going to impact the hormones. So for someone like that, I might, definitely talk about that. If I don't find a lot to work on and I'm like, I don't know if I can help you, but, this is pretty common. This is, your hormone levels are all over the place after having a baby. So it might just take time for them to level back out. That's a conversation. So it's never like one size fits all. It definitely is based on who they are, what their story is. But usually I would say everyone has different puzzle pieces, and we're going to have to look at different things as we kind of peel the layers back and work together. So it's hard to say like, oh yeah, I look at someone and I can see there's like a hormonal component. Obviously sometimes if a patient comes in, they're telling me, oh, I have like horrible periods. They're awful, like nothing helps. I've even been on the pill and that doesn't help. Sometimes I'm like, if you haven't seen a specialist, that probably is someone who you should see. If there's things going on relating to like your menstrual cycle, that's usually indicative that there might be a hormonal imbalance, or maybe something like endometriosis is going on, or polycystic ovarian syndrome, things like that are definitely impacted, like are kind of bigger systemic hormonal issues. So it kind of depends.
Do you find that, because I think what you do, Rachel, is a unique and kind of new and emerging application of physical therapy in health, because we know very little about our pelvic area, as you mentioned, the pain between the ribs and the knees. Do you find that patients come to you, or your patients come to you after they've been to their internal medicine doctor, their OBGYN, or do they come to you as a referral or as a last resort, or what's the pattern?
Fortunately, I will say we do get a lot of referrals as like what I'd say is like a first line defense. So, OB-GYNs or urologists or primary care doctors saying like, oh, you're having this, go see these providers. They'll be able to help you. So we are seeing a lot more of that, which is great. But there are people who are like, I've been searching online and I read every single thing I can find, and someone said that I should try this. And we're happy to try to help if we can. If we can't, I never make 100% promises to patients because I don't feel like I don't feel comfortable doing that. But my one promise is I always say, if I can't help you, I'm going to do my best to find someone who can.
Well, I think that promise to help women find a solution, whether you can help them or not, is totally reassuring. Do you find that you see more women as they're moving into perimenopause because their bodies are changing? Do you see them more often?
Yeah. I wouldn't say more than I see younger women. I would say it's probably even. But definitely I see everyone throughout the age. My clientele ranges, I think my youngest patient right now is 18 up into, 70s, 80s. So I see everyone across the board. So that's why I'm like, I wouldn't say I see them more, but it's definitely a contributing factor that, as you age, your hormone levels change, estrogen decreases, so people start to have more symptoms relating to their pelvic health and their things like that. So it definitely does I'd say it plays a role. I can't say for sure that I see more or less people as they age, but it does definitely play a role because as we age, estrogen decreases and all that vaginal tissue and the tissue around the urethra is all very estrogen dependent. So that is what can lead to the leaking people talk about as they get older. It can impact things like having more yeast infection or UTIs because the vaginal flora is now getting impacted by that change in pH as a result of the change in hormones. So I definitely see that as a factor in that patient population.
Mm-hmm. What do you commonly tell your patients around either prevention or self-care when they're not seeing you or in between visits?
It really depends on what they're seeing me for. There are some, a lot of my patients are coming in because they're having pain. And so for them, there's a lot of focus on trying to calm the nervous system down, doing a lot of diaphragmatic breathing, things like child's pose, stuff that's going to help basically calm everything, get the muscles to relax. I love things like foam rollers and massage sticks and tennis balls to help do self-myofascial release at home. I also love the Squatty Potty, so a lot of bowel care. Constipation is a huge contributor to pelvic floor dysfunction.
You said you like the Squatty Potty and constipations. Explain that a little bit more.
Okay, yeah, for sure. So we as humans were not meant to sit on the toilet to have a bowel movement. So when we were cave people living out in the woods, in the jungle, we would squat. So that's how we're meant to defecate. So ideally, you want to be in a squat position. So there's something out in the market now called the Squatty Potty, or you can just get a step stool from Target or IKEA and put that under your feet. And that basically puts you in the optimal position to have a bowel movement. And it automatically just relaxes your pelvic floor, primarily this muscle called the puborectalis that kind of goes around your rectum like a slingshot. And so it automatically relaxes that muscle, so that's easier for you to have a bowel movement and decreases the chance that you're going to be pushing, straining to have a bowel movement. And the more you push and strain with bowel movements, that's a lot of pressure on your little pelvic floor muscles, and that can contribute to dysfunction. So that's definitely something across the board I give people. And then depending, if people are if on examination I found they have what we call like a low tone pelvic floor, or they have difficulty activating their pelvic floor muscles and it seems warranted, then I would give them something like Kegels or kind of core stability exercises. So it just really depends on why they're seeing me. But I'd say the big ones across the board that I'm giving to people is the squatty potty or bowel positioning, as well as to drink more water.
Water has to be kind of the remedy for most anything. Well, Rachel, is there any kind of remaining piece of advice or thing you like to make your patients aware of that we haven't covered today?
Kegels are not the answer to everything, because I think I get that a lot. That, oh, I should be doing Kegels. When are we going to do Kegels? Why can't I do a Kegel? And so people come in kind of frustrated because they keep reading all the magazines or seeing online that that's what they should be doing. So that's kind of like probably my personal soapbox that I'm always, Kegels don't solve everything. Just like I said earlier, there is no one size fits all medicine. Everyone's going to have a different treatment protocol. But yeah, I think just in general that there are people out there that can help, and that, that having pain with sex or leaking urine, having bowel dysfunction, that shouldn't be your normal. There are people who can help you, and there's a lot of resources out there. There are things you can do about it.
Well, thank you, Rachel. This has been fantastic and highly informative. Oh my gosh. I didn't know testosterone, the pill, constipation, squatty potty would all be covered in one conversation, but you're a breadth of information, and I appreciate what you're doing. So thank you. Thank you so much.
Oh, thank you. Yeah, thank you.
Thanks for listening to my conversation with Rachel Gelman. Before you head out to buy a squatty potty, visit Rachel's website at www.pelvicpainrehab.com or check her out at @RachelGDPT on Twitter for more information. Up next, I talked to health and lifestyle coach Laura Dolch, along with one of her clients, about how coaching can help you get out of the way of your own success. You can hear my earlier conversation with Laura at Genev.com. Just search for Laura Dolch. That's DALCH. Talk to you soon.
Thanks for listening to the Genev podcast series. We welcome your feedback at Genev.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Genev podcast series is produced by Shannon Perry. Theme music by Smitty. And until next time, watch the Genev website for new stories and offers, all dedicated to women's midlife health.